What lab tests are used for leukemia staging? Leukemia staging is all about understanding how far the disease has spread and how severe it is, which helps doctors decide the best treatment plan. And like some cancers, leukemia doesn't always follow the traditional staging systems like the tumor, node, metastasis system. Instead, for certain types like chronic lymphocytic leukemia, doctors use specific staging methods such as the Rye or Binet systems. These systems look at factors like lymph node size, spleen or liver enlargement, and blood cell counts. For other types, especially acute leukemias, the focus is on identifying the type of leukemia and how much it has affected the bone marrow and blood. To do this, doctors relying on several key lab tests. The first is the complete blood count, which measures red blood cells, white blood cells, and platelets. Abnormal levels can suggest leukemia and help in staging. Next, a peripheral blood smear involves looking at a blood sample under a microscope to spot abnormal cells, like blasts, which are immature cells common in acute leukemia. Flow cytometry is another vital test. It helps identify specific cell types by analyzing markers on the cell surface, which is crucial for diagnosing and classifying leukemia. Bone marrow biopsy and aspiration are often performed to get a sample of the marrow, the spongy tissue inside bones where blood cells are made. These procedures are essential for confirming leukemia and determining how much the marrow is involved. Genetic testing, including cytogenetic analysis, looks for chromosomal abnormalities or mutations in the leukemia cells. These findings can influence treatment choices and give clues about prognosis. Imaging tests like CORT scans or PET scans are not lab tests, but are sometimes used to check for organ involvement, such as an enlarged spleen or liver, which can be relevant for staging. For chronic lymphocytic leukemia, the Rye and Binet systems classify the disease into stages based on physical findings and blood counts. In acute leukemias, the emphasis is on identifying the specific genetic or chromosomal abnormalities present, which can help guide targeted therapies and predict outcomes. Overall, these lab tests are essential tools that help doctors understand the extent of leukemia, guide treatment decisions, and provide insight into prognosis. Remember, each person's situation is unique, so always consult with healthcare professionals for personalized advice. Accurate diagnosis and staging are the first steps toward effective management and better outcomes.